So Dave, it sounds like we've got an effective treatment for chronic insomnia, CBTI, but what is it?
So CBTI stands for Cognitive Behavioural Therapy for Insomnia, and this is looking at how your thoughts or cognitions and your behaviours, your actions, influence the quality and the quantity of the sleep you get.
And what would I expect if I was going to a CBTI session?
So it's talking therapy. So you would be talking with your therapist, and really it would start with talking through your sleep. And this is important because what we know is that all people are different, people's sleep is different, and people's insomnia is different. And this is really important when you're trying to look at what kind of way that you're going to tailor CBTI. And as a therapy, it's really well suited to tailoring, because what it actually is it's a collection of different treatments that are put together as a system. And there's different ones. So some look at addressing the systems that control sleep in your body. So these are your circadian rhythm and your adenosine sleep drive, and trying to find ways to make these work for you and give you better sleep than against you and give you disrupted sleep. There's various cognitive therapies which are looking at your thoughts. So what we know about people who sleep badly, people who have insomnia, is that actually during the day they have an awful lot of thoughts about sleep. They're preoccupied with thoughts about sleep, and that these thoughts are actually very unhelpful. And so there are techniques looking at addressing that. Also, for a lot of people, the insomnia is based around stress, worry and anxiety, particularly around sleep. So there's other therapies looking at that, looking at how to relax and looking at the core reasons for your anxiety. But when you have these different systems around, it means that you can really personalise treatment for someone with insomnia. But what you have to do first is have that initial assessment, and this is all done through talking as part of the therapy.
Thank you. Often people say to us that they've had some form of CBT before. Is CBTI different from CBT?
Yeah, so CBT, cognitive behavioural therapy, is used for a number of different conditions. It is used a lot in depression and anxiety. It's a very effective treatment. But this is specifically for insomnia. And so what you want is, if you're going to find someone to do CBT for insomnia, you need to make sure that this is something they're specifically trained in. It's not part of the kind of the broader world of CBT.